I'll try to be short in order to finish the picture of hepatitis B in Romania, hepatitis C in Romania, excuse me. But first, before I start, I want to, I don't like that place. So, excuse me. I want to explain something, especially for US colleagues. When we are talking about Georgia, Moldavia, Ukraine, Moldavia, and the former U.S. countries, USSR countries, we are talking about 4 million, 5 millions. For sure, Ukraine is a special situation. Romania has almost 20 millions. It's quite different. It's not so easy to reach the goal of elimination for 20 millions with a high prevalence, with a 50 years of communism, instead of 1 million, 2 millions of prevalence of population. So I want to tell you a short story about how we have decided to closing the gap to reach the population that we couldn't till then, because when we start the population-based screening program, we've seen that the prevalence is not so high. It means that we have to check in other places, and we've decided to check on prisoners. I'll try to engage the infectious disease specialist in this kind of program. I don't know, in 2015 or 16, but they said, now we have HIV, we are not interested in, is too difficult. So we've decided in our society, together with Professor Gheorghe, in our Romanian National Society of Gastro and Hepatology, to start first liver on European funds, and then and I thank you for this, with the participation of the AbbVie and with their enthusiasm and with our work, we've succeeded to screen in Romanian prisoners. I think that it's like this. Yeah. You know that in 2021, WHO have decided to publish an interim guidance for countries because they were not satisfied about the elimination goals, and they said, look, you have to remember that 2030 it will be soon, and you've never reached the goals. And then they decided to have 4 options. I'm sure that you are aware about. We've decided also to be in Romania option D, to eliminate B and C in the same time. And last year in 2020, EASL and CDC and also ECDC and WHO recommend again that adapt the screening program to the local situation, taking into consideration the prevalence, and start the micro elimination program. And what is that we've done? But look. And I just said more than 10 years ago about microelimination. It was not about HCV, it was about HIV. But look, which are the targets. In order to say that a population or a group, it's micro-eliminate, you have to reach 100% of people using services, and 90% of tested and 70% of treatment. It was about HIV, now it's about hepatitis C. It's very difficult to reach You have to recognize that it's very difficult to reach these goals. So we've decided together with, in the same time, in parallel with Livero, to start a microelimination screening in prisoners in Romania. We have 34 detention centers, and we had in this moment more than 30,000 person in detention, 23,000 living with a turnover of 8,000. So we had a lot of patients to screen. 34 we've decided about 27 of 34 in 3 regions. Together with the institutes and the hospitals and the university from Bucharest, which is the capital, and the most important cities, university cities from the northeast of the Romania, which with the highest prevalence, and with the lowest prevalence in the northwest of Romania in Cluj area. We designed the methodology together with the Romanian society, the methodology especially for prisoners. We organize and mobile teams with doctor residents, a lot of psychologists, a lot of volunteers from the students, and we start the campaign. First, we start the campaign, awareness campaign, a lot of awareness campaign in each prisoners in each detention center that we visited, with the educational tutorials, with videos, with the flyers, with talking with doctors, with pathologists, in order to not only to raise the awareness, but to convince the prisoners to be tested. I know, I'm sure that you know that how difficult it is when you don't have an opt-out methodology. Then after the testing, we take the blood. We take the blood from the prisoners and go with in the hepatology units or gastro units from this hospital in order to stage and to start the treatment as soon as possible. Look, more than 1,000 kilometer traveled, more than 11,000 prisoners tested till this moment. But look at the last more than 10,000 not tested yet. What's happened with the data, which is one of the most important but most difficult step in the program, to collect the data and to analyze the data, because during the visits in detention center, we couldn't use any PCs or mobile or IT. Yeah, because we all the data that we collect, we have to collect on paper, and then to translate to IT data, which is the most difficult. We don't understand why, but we couldn't change this. What's happened in the hospital phase? Liver disease assessment. It means that when we get we transport the prisoners from the detention centers to the hospital in order to make to perform the staging. We'll try to get a part of them one-stop shop. I will explain immediately, in order to start to finish the staging and to start the treatment. And because of administrative and administrative and legislative barriers, we couldn't recommend the treatment immediately. We find out the viremia, and we perform the staging, because we could perform the staging in the detention center, but we couldn't recommend the treatment because only of administrative barriers. These are a part of data. Some particularities, not so many PWIDs, not so many like we expected. It is a special population in Romania. They live in the 19th century. In the 19th century, they couldn't use IV drugs. There are not so many. There are less than 40%, and self-reported less than 20. The most important part of them are men. Next. So the prevalence. Keep in mind the prevalence that Professor Gheorghe said. And compare with this data. The prevalence only in this data that we could analyze since now, it's more than 7, and in some parts it is more than 9. It's more than 9. The prevalence, it's 10 times. It's almost 10 times more than general population. It means that we have to continue and to return in this group, in these vulnerable groups. This is the real situation. We couldn't assess and treat just 42% and treat just 32, even if we made a lot of efforts in order to dynamize the process, in order to shorten the process, only because of administrative barriers, which were the limitation, difficulty of awareness campaign. There were the first campaign in Romania, and maybe we're not so talented, but we'll try a lot. And also the need for transport prisoners, it's also very difficult. Instead of one-stop shop, instead of opt-out recommendation like in USA, like in Australia, but which are the opportunities especially experience for future projects that we are involved or we've been involved. Plans for the near future, two kind of plans: to continue testing in detention center and to return to improve our model to one-stop shop, and if it is possible to propose a model of best practice, maybe with opt-out, which I think that it could be the best, but I don't know if only in, I think just only in UK, in Europe it is possible with opt-out. I don't know if we'll succeed or not, but one-stop shop, it will be better than now. And also to integrate this model in national control plan in order to identify some new funds. And the second, regarding the Ukraine, regarding our neighbors, there are only, I have to explain, from Romania have been passed more than 3.5 million of Ukrainians, but they just 100,000 live in Romania now. More than a part of them are employees, and they are, since the beginning of the war, they are fully insured. They can reach all the treatment for diabetes, for HIV, for hepatitis, diagnosis and screening for all Ukraine's refugee. Even if he is not working, or even he is working, there are a lot of young women with children. There are not so many. There are not so many men. But we have more than 200,000 employees from out of Europe. India, Pakistan, and other countries from Asia especially. We'll have to focus on them because there is no one to be interested in. The refugees and the authorities, the local authorities or the national authorities are not interested in screening for hepatitis at the beginning of the working, because they have a lot of contract employees contract, or at the entrance in the country. So we'll have to design a screening model especially for these foreign workers. So thank you.
Thank you very much.